More and more people are reporting infertility these days and seeking treatment. Why is that?
Increasingly, women are trying to have babies when they are older compared to the age, female age a few years ago, a few decades ago. So, currently women want to advance in their career, or they want to build a house, or they want to find Mr. Right, and then by the time they find Mr. Right, they are already in their 30s. So, the best age to have babies with regards to female is between 21 to 29. Women out of this age group can also have babies, but the ability to conceive a baby, it starts to decline after a certain age. So, this is one of the key reasons that we see in the current days. The other reason which we all have to bear in mind is the increasing incidence of sexually transmitted infections. I am going right into this hot topic because we see more and more men and women getting affected by a particular infection called chlamydia without even knowing that they have had this infection, and sadly this infection can quickly damage the fallopian tubes. And equally men can have testicular inflammation as well, affecting the sperm quality. So, these are the main reasons men and women have to bear in their mind.
How easy is it to have successful treatment?
The treatment methods, there are so many different methods of treating infertile men and women. When it comes to the simplest way of helping, it basically depends on the lifestyle, because more and more men and women are having difficulties in conceiving simply because of their lifestyle. For example, smoking, drinking alcohol, recreational drugs, all of these can affect the sperm quality in men, and equally it can reduce the egg reserve in women. So, a lot of women actually do not know what this egg reserve means, which I would like to explain a little bit. Women, when they are born with certain number of eggs that are given to them by their mothers when they were in the mother's womb itself. And this egg reserve, the certain amount of eggs that were there, get released on a monthly basis. So, you can imagine when a woman ages, the number of eggs in her ovary starts to decline, and unfortunately smoking can speed this process up. So, lifestyle changes is one simple thing which we can adjust and improve the fertility. And then the other condition which we commonly see in Asians, especially in our part of the world, is what is called polycystic ovary syndrome. In polycystic ovary syndrome, the women report irregular periods, especially infrequent periods. So, they do not get menses every month. Instead, they get every 2 months, every 3 months, and I have seen women who do not have periods for a year or 6 months or 2 years even. And the reason for this is their ovaries do not release the eggs on a regular basis. So, what do? We simply make them do lifestyle changes, because when their eggs are not released properly, they start to put on weight, they develop a lot of hair on their face, acne and all sorts of complications. So, we let them lose some of the weight, which itself can start the ovaries to function beautifully again, or we can simply give them some tablets to make their eggs be released from their ovaries. So, these are some simple forms of treatments which can be successful.
Are there any tests to check fertility?
Yes, of course. For women, the basic test that we do is a pelvic ultrasound scan, with which we can examine the woman's womb, we can check her ovaries, and I mentioned the egg reserve that also can be checked with the pelvic ultrasound scan, and we also check the shape of the womb, because the shape of the womb is very important to to conceive and also to carry a baby till full term. Women also will need some blood tests to check their general health, including thyroid, to see whether they are fit to conceive a baby. With regard to men, the basic test is a semen analysis, in which we check whether the sperm concentration is okay. What I mean is the count of the sperm, and we also check whether the motility of the sperm, that is how fast the sperm is able to swim across, and also we check the shape of the sperm. How we all have a form and the external shape, likewise the sperm also have a specific shape. It has a diamond shaped head and a long tail, and it also has a neck piece and a cap. So, all the structures should be there for men to fertilize an egg and to become a father. So, we check these things in his semen. In women, we also check the fallopian tube. The reason is, when somebody is trying to conceive, a couple is trying to conceive, there should be enough normal moving sperm which then move into the womb towards the fallopian tube, and they find the egg. And so, the egg has to be released from the ovaries, and the egg and sperm actually meet in the fallopian tube to fertilize an egg, and an embryo will come back into the womb to develop. So, it is absolutely essential we check all these components, which are the semen analysis, the woman's womb, the woman's fallopian tube and her ovaries.
If couples don't conceive with simple measures, what other treatments are available?
There is yet another simple treatment modality available. It is commonly done in many hospitals. The simplest one is called intrauterine insemination. So, in this technique what we do is, we get the sperm of the husband, we filter and concentrate the best sperm, and then place a little volume of it into the woman's womb. By doing this, the concentrated sperm is placed close to the egg so that the woman can conceive easily. Now, this technique is suitable only for those men with minor sperm issues. If they have a major issue in their sperm, then this technique does not give a successful rate, and these men will need a further detailed treatment called IVF.
Is IVF done at Ninewells Hospital?
In vitro fertilization is done in Ninewells Hospital with very good success rate. IVF means we stimulate the woman's ovaries to produce multiple eggs. Now we know that every woman actually releases one egg every month, but during IVF we make them produce multiple eggs, and these eggs are collected from the woman, and at the same time the man produces his sperm, and we mix the sperm and egg together in the laboratory and then create the embryos, and these embryos are actually cultured in an incubator for 3 to 5 days, and very good quality embryos are placed back into the woman's womb to make her pregnant. So, this is in vitro fertilization. This is widely available in Sri Lanka, and yes, indeed in Ninewells Hospital. When this technique is used, usually a few more embryos may also form, that is in surplus of what is needed for one treatment. In this scenario, we actually freeze the extra embryos, good quality embryos, so that the couple could use it in future, for example for another baby, or in case the first attempt, if they have been unlucky, then they can have another go with the frozen embryos.